has been deeply involved in supporting the government's efforts in managing the pandemic. The college is a member of the multi-agency team on COVID-19, tasked with quarantine and isolation facilities preparedness. KMTC is also a member of the National Advisory Committee, assisting in the planning of COVID-19 containment interventions and strengthening of health systems for universal health coverage in the counties. Further, 44 of KMTC campuses are being used as quarantine and isolation treatment centers across the country, having so far hosted 4,366 clients in quarantine in 421 locations. In the meantime, as part of the corporate social responsibility, the KMTC board has availed resources to enable its 71 campuses countrywide to conduct health education and promotion, donate hand washing facilities, and provide mental health and psychosocial support to mitigate the effects of the coronavirus. For this, we commend the KMTC board for playing such a crucial role during this pandemic. And today we are joined here by members of this board. We have the chair, Professor Philip Kaloki, who has been with us all day. And we also have the CEO of KMTC, Professor Michael Kipto. This morning, as you witnessed, we also had a function here of receiving donations of personal protective equipment from the Intergovernmental Authority on Development, with the Executive Secretary being present here and personally handing over this donation to the Ministry of Health for use in the Dadaab refugee camp. And that is why we are also joined today by His Excellency the Governor of Garissa County, Ali Korane. I once again want to thank His Excellency, the Executive Secretary of IGAD, for his support to the Kenya government, and I assure him of our support and cooperation to IGAD. Of course, IGAD is supporting its member states across all sectors, but for us as health, I think we have, particularly during this COVID pandemic, we have enjoyed a very good relationship in the support that we are getting from the IGAD COVID-19 response effort. As I mentioned, the Kenya government supported IGAD to set up its office here in Nairobi at this KMTC Karen campus through a memorandum of understanding, and I wish to confirm that we shall continue to host and support the IGAD presence here as part of our contribution to IGAD and fellow member states. On the COVID-19 pandemic, the government appreciates this continuous support from IGAD towards addressing the disease in this region, and in particular targeting the border counties in the country. We strongly appreciate IGAD's support on COVID-19 pandemic response. If I now shift to the main agenda of the day, which is sharing with you the COVID-19 statistics in the country over the last 24 hours. Today we report 271 people who have tested positive after sampling 4,019 cases in the last 24 hours. We now stand at 30,636 positive cases in the country, and we have also pushed our cumulative number of tests to 398,585. Among these 266 cases that we are reporting today, all of them are Kenyans, with the exception of 4 who are foreigners. 178 of them are males and 93 are females. The youngest case is a 1-year-old baby and the oldest is 80 years old. The distribution of the cases by counties is as follows. As usual, Nairobi leads with 99 cases, Kiambu with 20, Laikipia with 20, Migori with 18, Uasin Gishu 18, Busia 12, Lamu 11, Samburu 11, Turkana 10, Kajiado 9, Makueni 4, Garissa 4, Nakuru 4, Mombasa 3, Machakos 3, Muranga 3, Kisumu 3, Kilifi 3, Taita Taveta 3, Tana River 3, Nandi 2, Nyeri 2, Marsabit 2, Kirinyaga 1, Vihiga 1, Embu 1, and Kitui 1. I'm happy to inform you also that 208 patients have recovered from the disease. From this number, 161 have been released from the home-based care program, while the remaining 42 were discharged from various hospitals where they were receiving care. This brings the total number of recoveries to 17,368. And I want to take this opportunity to extend our greatest appreciation to our healthcare workers for this great achievement. On a sad note, 5 patients have succumbed to the disease, bringing our total fatality to 487. We send our sincere condolences to the families and friends of those who have lost their loved ones. Before I will now introduce the Executive Secretary of IGAD to say 1 or 2 words on what IGAD is doing in this area of COVID-19 response. And is our guest today, and I want to ask the media, let us listen to the Executive Secretary, but I would not want any of the questions to be posed to him. The questions will be posed to this podium here. Executive Secretary, Your Excellency, please let me welcome you to say 1 or 2 words.
Thank you. Thank you very much, Principal Secretary. I am very happy to be here. As you have said, this morning we were in the ceremony of handing over of the PPEs that are very important for, especially for the people who are in the refugee areas. This region, IGAD, is facing the challenge of not only COVID. We are now at this time we have a crisis of 3 types. That is, number 1 is COVID. The second is the food security issue, and at the same time we have, as the whole IGAD region, the issue of peace and security. As you know, IGAD has established in 1986 with the founding fathers that at that time to respond to drought that has happened in the region at that time. Starting from that time, IGAD was working in different areas, not only in emergency issues, but also in development, climate change, peace and security, and as well as the emergencies like COVID that happening in the region and throughout the world. After the decision of the heads of states and governments of IGAD region, we came up with how to coordinate the effort of the member states, because we share common border, we share the people go from one border to other area, we have transport connections, and so on and so on. So no one is immune. One country cannot confine itself alone. Because of that, the intervention of IGAD started on these coordinating areas. So our regional response is specifically based upon the internally displaced people, refugees, as well as the returnees and the urban vulnerable population and pastoralists as well. So we are working very closely with member states, all 7 member states. Our member states are 8. Eritrea is not active now, but we consider Eritrea also a member state. So We are working with all member states, especially on the areas of the member countries are not active in refugee areas and so on and so forth. So far in the region, as you know, the trend is still upside. Ethiopia yesterday witnessed more than 1,000 cases. The second case is in Kenya. Kenya is also yesterday and today is above 200. And at the same time, Sudan, 96. Djibouti, yesterday it was 3. Somalia, 7. Uganda, 60. Generally, when we analyze these things, this thing is still a challenge for the region, not only for the region, but also for the world, specifically for us, the region who is suffering by heavy flood and locust invasion. These things makes the region a region of a triple threat region. So that's what IGAD is doing. We are responding with member states on this issue. We are organizing or coordinating the resource mobilization from our partners. So I'm here today to work with the officials of the Ministry of Health as well as our brothers and sisters here to work together to identify the area of coordination. So I'm very happy all member states are working very closely in the border areas, in pastoralist areas, as well as in the migrant areas. So this is a very important symbol of coordination in the time of challenges. So we hope that we'll come over with this problem. Specifically, if we coordinate our efforts, this will not be a big challenge. Already this region is passing through a different challenges that we have faced. Thank you very much.
Thank you very much, Your Excellency. And now that we also have a governor from one of our counties, I want to invite Governor Ali Korane to say a few words. And I know that the media has been asking us quite frequently what is the level of preparedness of the counties. Have the counties met the targets that were set for them in terms of the level of preparedness? And I think this is an opportunity perhaps to inform the media about this, what your efforts are in your county. Welcome.
Thank you very much, CS Aman, His Excellency, the Executive Secretary for IGAD, the Board of KMTC, distinguished guests, ladies and gentlemen. Let me take the first the opportunity to thank the Executive Secretary for the donations to our refugee camp. The Dadaab refugee camp is the biggest refugee camp in this region. We host very many nationalities. In terms of the infections in the county, 80% of the infections in Garissa County are from the refugee camps, the Dadaab complex. So this help and of PPEs is going to go a long way in the prevention of further infections in our camps. Secondly, I would like to congratulate the Minister of Health. I think so far we are happy with the coordination of the efforts to contain this pandemic, and I would like to congratulate them for the good work they have done so far. I would like to thank also the board and the staff and the management of the KMTC in Karen for hosting us the whole day and for their meticulous hospitality. About preparedness, I think you know that our rural health infrastructure is very fragile, is inadequate, but since the pandemic started, we have made great effort to ensure that we prepare for our worst case scenario, and so far we are satisfied with the preparations which have been made and with what is happening in the counties. And we will continue to improve on those efforts, and we think we will be able to counter the spread of this pandemic. Finally, worried to note that the infections, recent infections, have predominantly been among the young people, including even infants. What I suspect has happened is our messaging since this pandemic started was putting a lot of emphasis on the threat of this disease to the elderly and those with underlying conditions. And even when some people die of this disease, we have always tried to attribute to the underlying conditions. I want us from now forward to make our message neutral. I think that previous messaging has led to recklessness on the part of our youth who think that either the disease is not a threat to them, or if they got, then they will not lose their lives because they have no underlying conditions. I think what we need to do now is to make our messaging neutral, that this pandemic is a threat to everybody, regardless of age or underlying conditions, and our youth need to take the precautions. Because the elderly people like me, I think, have taken cover. Since there was a lot of messaging that anybody in that bracket was threatened. But the youth, on the other hand, have been a bit reckless, I think, in their behavior. So let us emphasize for everybody that this disease is a threat to everybody, including infants as young as 8 months old. And we need to be very careful with our lifestyle and follow the protocols which have come out of the advisories from the Minister of Health. Thank you very much.
Thank you very much, Governor, and your point is very clear. Indeed, this disease does not distinguish between the age cohorts. Our youth, who form the largest proportion of our population, if I'm not mistaken, over 70% of our population, is composed of youth 30 years and below. And we have in our reporting shown that young, healthy people without any underlying condition also succumb to this disease. So the messaging must now be tuned, and we'll continue to urge these young people to stop the reckless behavior, the feeling that they are immune to this disease, the flouting of the regulations that have been put in place so that we don't spread this disease. The other danger with the youth is that they are also spreaders of the disease because many of them remain asymptomatic and therefore are a danger in terms of spreading this disease. So that message will be very clear to the youth. I think we now will move to a short question and answer session. Mutua?
Zainab Mohammed, TV47. Number one, what is the current situation of COVID-19 in the refugee camps, specifically Dadaab and Kakuma? Number two, there are claims that our curve is going down, our COVID-19 curve. How true is this?
Bashirima Kapombe, Citizen TV. The number of positive cases are dropping. What does this mean? Have we reached our peak, or is it the beginning of flattening the curve? The status of targeted testing, and also the status of disbursement of allowances to frontline workers. Some even here at KMTC feel left out. What is your response to that?
Thank you. I'm Haiba from Ebro TV. My concern is about, I understand that we do have some quarantined persons in this facility. Some of them actually claim that they were tested about a week ago. What exactly is happening? Because I understand that the results are supposed to be released maybe about 48 hours. And then my question to Governor Korane, you said that you are actually prepared. Out of the 300 bed capacity, what is the status in the county? In your own county specifically, how many beds do you have so far?
Yes, ujambo katibu. Naitwa Boni kutoka Euro TV. Nimejifikisha kwa hichi kipasa sauti nikiwa na hamu ya kutaka kujua kaunti ya Mombasa ilifanya nini visa vikaenda chini. Ni kwamba shughuli ya kupima imekuwa chini, wananchi wamekuwa watiifu, ama Mungu anawapenda kama wa Tanzania?
Okay, thank you. Thank you. TV47, the current situation of COVID in Dadaab and Kakuma. Dadaab and Kakuma, of course, still form, although they are refugee camps, they still form part of the national reporting system, and so they are included in the reporting system. And I will ask Dr. Kuria with me here, who may have the statistics on the numbers in those camps. But as you know, we have always been reporting when we have COVID cases, particularly in areas where we feel is high risk, like the refugee camps or within our correctional facilities. We always do provide that information and the breakdown of that. But I can say that the condition, I think, is under control in those areas. We have systems of monitoring. We have the testing systems, networks that we have put in place. And so we do follow up on cases all over the country, the contact tracing and so on. Is our curve going down? This question was also posed by Citizen TV. As I said yesterday, the same question was posed, and we said it is too early for us to be able to make any determination whether this is a trend, at least for the curve coming down. Our tests fluctuate. When we have enough testing kits and supplies, we are able to ramp up our testing. And you know, testing, number of cases that you unearth is also a factor of the number of samples, the size of the samples that you collect. While that might be the case and might be variations in the number of testing, you will note that in the last few days, the number of tests we conducted have come down somewhat, partly because of limitations maybe with our supply chain and the test kits that we have. It's a little early to determine whether our curve is coming down. We will wait and see. There are other indicators also that will give us an indication of where we are in this COVID response. And of course, the strongest indicator really is people who get hospitalized because of COVID-19 and people who actually die from COVID-19. Those indicators are very, very important for us, and we carefully follow those indicators to determine where we are as far as this COVID response is concerned, the COVID pandemic is concerned. Targeted testing. We have looked at our strategy for testing. Where we are today in this pandemic, with widespread community transmission of the disease in almost the entire country, I think it behoves us to be able to reevaluate our testing strategy and apply our limited resources for testing in the right places. So our testing is now going to be targeted to areas that we feel are important, hotspots or areas that are of high risk, where we can apply our testing and be able to unearth the level of infection in these areas and take the necessary measures to be able to contain the spread of the virus in these areas. So we will see that we will be focusing our testing in certain areas, and especially also in those groups of people who are considered to be at high risk, including our elderly and vulnerable people. We shall be focusing testing in those areas. At the same time, there is some level of testing that also occurs when we have institutional cases that are reported within institutions. I think in those cases we also have to move in fast and be able to do testing of institutions, whether they are government institutions or other institutions where the likelihood of spread because of people working together closely is high. We also will continue to do that. In terms of disbursement of allowances, I actually, to be honest, have no answer for that. I do not know where we stand on that. I don't know if my colleagues who may have a chance to say something might have some response to that. NTV, this particular facility, yes, as I said in my brief, also KMTC has been a big player in terms of providing quarantine facilities. Yes, there are cases that are quarantined here. The original protocol for quarantine was that once, WHO recommended protocol was that once candidates have gone through their period of quarantine, which originally was 14 days, subsequently even reduced to shorter than that, that they would undergo tests before they are released. That has been revised. That protocol has been revised. In fact, now there is a new protocol by WHO which quarantines people for a specified period of time, after which they are released. So we are in that transition where we are now moving to not keeping people who are quarantined for excessively long times. Once we are certain that they pose no clinical threat or transmission, then they can be released. And I think that transition is happening. Dr. Kuria might expound on that. I will leave the one for the governor. I think he has registered the question that was directed to him. Then the final one was what is happening in Mombasa. Are we seeing flattening of the curve of sorts in Mombasa? Yeah, I would say that perhaps what's happening is that, every county is going to have its own, although we have a national trajectory, we talk about the national curve. This national curve is composed of several other curves that come together. Every county will have its curve. Some curves will be on the rise. We are seeing Kiambu now on the rise. Some curves will be reaching some level of plateauing. So maybe perhaps Mombasa is reaching its level of plateauing. Yes, testing does have to do something with this, because the extent of testing, as I said earlier, it will give you the extent of cases that you may have there. But we are happy with what we are seeing in Mombasa. It seems that the containment measures are yielding dividends, and we are beginning to see less and less positive cases emerging from Mombasa. Let me now hand over to His Excellency Korane to respond to the specific question targeted at him and his county.
Yeah, commensurate with the number of infections or positive cases in our county, and also on our own projections, I want to confirm that as a county we are ready for this pandemic, especially the isolation facilities. Currently, we have 294 isolation beds, including those which are in the refugee camps. We have 108 beds facility which is getting completed this week, and we are going to start another facility for 50 more beds, which will take 3 weeks, I think, which is going to start this week. So I think overall, we are happy with our efforts, we are happy with our preparedness, and we think that we are ready to counter this pandemic. Thank you very much.
Thank you, Governor. Dr. Kuria, do you want to respond to some of those questions?
Thank you, the Waziri, His Excellency the Governor. I think there was one that was asking about the exact figures of positive cases in the Dadaab and Kakuma. Let's say we have not disaggregated this as at this moment, but this data, as I said, is always available and can be provided once you disaggregate it from our data center. There was a question on KMTC quarantine facility and those that were tested 7 days ago. We are aware of some continuing trend of delay in results, and as a ministry we have addressed this and developed new guidelines to other testing laboratories in terms of when they release the results, and we expect to get better outcomes from this meeting. But by and large, it is not a delay in testing. I think it's a question of the delay of the results, and much of it is arising from the way the case investigation forms are arriving in the labs. So I am sure for KMTC, Karen, where the results have not been released, immediately after this, we should cross-check with the lab again, and they should be available and reduced to the quarantinees. There was a question on whether the cases are going down, and I think the CS has addressed it amicably, but we must be very cautious before we start saying that our curve is flattening. We do not think so yet, and we have to take this with a pinch of salt, and let us not believe our curve is flattening. We have realized, of course, the number of tests are also not as many as we were testing 3 weeks ago. The CAS has addressed this. But of course, there are good indicators in terms of reductions in case fatality. Like in Mombasa, I think the case fatality has gone down. But the best indicator is the number of cases that are in hospitals. When this starts going down and the deaths start going down, then you can probably start saying, yes, our curve is going down. But by and large, our positivity rate has remained almost the same. So if you take 1,000 samples and 550 remain positive, that rate is to tell you that the positivity rate is still at where it was, at 5%. So let us not rejoice at the reducing numbers that are announced every day and say our curves are flattening. It is not yet, and we have to assess it further using other indicators. So urging us not to relent on our efforts at wearing our mask, which is the most effective way so far in preventing the spread of the virus. So thank you very much, and God bless you.
Thank you.